Hi, everyone. Matthew Glover from Executive Council here. Thanks for taking the time to join us. Our news release just went out, so we're going to be starting in about 5 minutes. Thank you. Hello, everyone. Apologies for the delay, but thank you for taking the time to join us. From the Legislative Building in Regina, we have Health Minister Jim Reiter and Saskatchewan's Chief Medical Health Officer, Dr. Shahab. On the line today, we have Scott Livingston, SHA CEO, as well as Dr. Rashad Hansia and Dr. Jessica Minion. We'll open with comments from Minister Reiter, as well as Scott Livingston, and then we'll move into questions. Minister Reiter.
Good afternoon. Over the weekend and including today, we're reporting 56 new cases in 3 days. These cases are predominantly in southwest and west central Saskatchewan. The Ministry of Health, the Saskatchewan Health Authority, and the Hutterian Safety Council are working together to address this. This includes increased testing and contact tracing in affected communities, ensuring those who test positive and their close contacts self-isolate, raising awareness in those communities about good health and safety practices to protect yourself and those around you, and ensuring compliance with self-isolation orders. I should note that the two Hutterite communities in the RM of Maple Creek that were the site of the initial outbreak are down to a very small number of active cases. So these actions do work to get the outbreak back under control. Starting today and in the weeks to come, Saskatchewan residents will have access to additional everyday health services. This marks the beginning of Phase 3 of the service resumption plan the Saskatchewan Health Authority announced back in May. Services that will resume in the next phase include further enhanced mental health and addiction support, including the openings of social detox and addictions inpatient treatment, additional chronic disease management, wellness programs, stroke prevention, and specialized services for clients with developmental disabilities, autism, and brain injuries. As well, in this next phase, we'll continue to expand surgical services across the province, returning to between 75% and 85% of our pre-COVID volumes. Some areas of the province are seeing surgical volumes in excess of this number. For example, in Moose Jaw, the FH Wigmore Hospital is achieving beyond 100% of their pre-COVID surgical levels as a result of new surgeons that were recruited to the community. Reducing that backlog further remains a key focus for this government and for the Saskatchewan Health Authority. Diagnostic imaging services will also continue to increase. However, they are currently performing at 90% of their pre-COVID service levels overall, with MRIs at 91% and CT at 93%, for example. This is a great accomplishment due thanks to the hard work of many. Today, we're also announcing that effective Tuesday, July 14th, Saskatchewan will move to a universal testing model for COVID-19. This means COVID-19 testing will be available universally to anyone who requests it, regardless of whether they have symptoms or not. Patients are encouraged to contact Healthline at 811 to arrange for testing. This move supports our earlier commitment to increase testing capacity in the province because we know the more people that get tested, the more quickly we can take action to protect others. I'd now like to ask Scott Livingstone to add a few comments. Scott?
Thanks, Minister. Again, I'd just like to acknowledge that I'm joined today by a couple of Saskatchewan Health Authority colleagues, Dr. Rashad Hansia, our Physician Executive for Integrated Urban Health, and Dr. Jessica Minion, who's one of our lab experts. Both will be available to answer questions in just a few moments. I'd like to begin by thanking our healthcare workers who have been working hard over the first two stages of service resumption since May 19th and continue to support us now as we enter the third phase of service resumption, and at the same time maintain our response to the COVID-19 pandemic. As Dr. Shahab continues to say many times, that this is less of a sprint and more of a marathon, and we will continue this new normal for some time. Today, if you look online at the Saskatchewan Health Authority's website, you're going to see since May 19th, when the first phase of service resumption was announced, over 544 services have now resumed across the province. Overall, we're pleased with our ability to bring these services back online safely and quickly, but we are still implementing strategies to keep patients and providers safe throughout service resumption. So far, patients and their families have been extremely understanding of the additional criteria, screening measures, and changes relative to how they have traditionally received service. We also know that many patients are anxious and awaiting their further resumptions of services to address things like elective surgery and other clinical face-to-face meetings. As the Minister has indicated, starting today and in the weeks to come, we will continue to expand service offerings to further everyday healthcare services for people across the province. And while we know our providers are eager to return to their new normal, I must stress that services coming online are being done as quickly and as safely as possible. I've also mentioned before that we've recognized that dealing with COVID-19 for some time, we also have to ensure that our pandemic response maintains a focus for the SHA, including allocating staff to our various pandemic response areas, including testing and contact tracing. This has been particularly important as we see increased caseloads, such as the ones in the Southwest, but also the cluster of cases in Prince Albert. Maintaining that capacity to respond will be an ongoing need for us as we wait for a vaccine. I'd also like to provide a quick update for folks on the efforts to support virtual care delivery in Saskatchewan. We know that face-to-face care with a provider, cannot be completely replaced through the use of virtual care. But since March, with the expansion of this offering, we have seen it minimize some of the slowing downs of services, but also provide another avenue for patients to make contact with their clinical providers. Since initiating the expanded virtual care options as a result of pandemic in March, more than 175,000 appointments have been delivered through this option. Virtual care delivery was fast-tracked in a major way over the past few months and has, as I said, helped been able to tap into potential for virtual care in the months and years to come with respect to innovative ways to provide more services to Saskatchewan people across the province. With respect to testing, as the Minister has already indicated, as of tomorrow, July 14th, COVID-19 testing will be available universally to anyone who requests it, regardless of whether or not they have symptoms, across SHA testing sites and assessment centers. Today, our laboratories are processing approximately 600 COVID tests per day, but we have daily capacity of around 1,800 per day. By calling Healthline 811, patients can be triaged and sent to the most appropriate testing center. Just a heads up or a note that the time between requesting and receiving a test may vary per individuals, as we are still placing a priority on those that are symptomatic or those individuals that have other risk factors, such as those patients who are immunocompromised receiving cancer therapies. With this new change, we'll be watching the numbers closely for testing and ensure that we can respond to the needs that are out there as we prepare to further increase our testing capacity near the fall of this year, to prepare for potentially a second wave and to ensure that we can maintain services at the same time, mitigate the effects of COVID-19 to the greatest extent possible. I'd like to end my comments by thanking those healthcare providers across the province and physicians, and also to the people of the province who continue to do their part to fight the virus. Simple actions like wearing a mask, washing your hands, and staying home when you're sick all helps in containing the virus. And we cannot do our jobs as providers without your help, especially as we move forward in the fall and continue to strengthen the testing and contact tracing capacity. This support will become even more important. So please do your part and stay safe. With that, I'd like to open up the floor to questions.
Thank you, Minister. Thank you, Scott. We'll now take questions. We'll take our first question from the line.
We have Ashley Martin with the Leader Post.
Hi. Can you tell me the 6 cases in Saskatchewan, were they related to that the employee at the Canadian Brew House? And that's my first question.
So I can speak to that. So as you know, whenever we have a case in a public setting where there may have been people who cannot be contacted through other means, we do issue a public service announcement. So there was one issued for a restaurant and bar in Saskatoon. At this point, we have no further cases linked to that PSA. However, we have had an additional case linked to a PSA for the Emma Lake area. And this really shows the value of PSAs, because it creates some awareness for people who may have visited a certain facility and are more aware to seek testing if symptomatic. But I just want to say that in the new normal, as we are out and about, we shouldn't just rely on a PSA. If we, many of us are out and about, or even if you're not out and about, if you have any symptoms that suggest COVID, seek testing. If you have any concerns that you may have been in contact with the case of COVID and have symptoms or concerns, seek testing. I think that is really important, because by seeking testing, You then, if you test positive, you can then public health can follow up on your contacts. And the other thing is, stay home if you're symptomatic. And just one other comment that the cases that we have seen in Saskatoon and Regina continue to be occasional cases that are either linked to international travel, travel to other provinces, and their close household contacts. So there's no further clusters of concern in Regina or Saskatoon at this point.
Do you have a follow-up question, Ashley?
Yeah, just relating to the large number of cases in the Southwest that have been announced today, can you give a sense of, I guess, the situation? I mean, there's a lot of RMs listed in the news release. Like, how were these people all linked? Like, was it a community transmission kind of thing? Were there, like, people known to each other spreading it? Because that seems like just a huge jump in cases in a relatively short period of time. So any more details you can give on the situation there would be appreciated.
So there's two separate things happening in the southwest and central parts of Saskatchewan. There's around 8 cases over the last 3 to 4 days that are in the community. They are not linked to any other cases, so they are individuals who may be working in different settings. So related to that, public health is following up with case contact investigation, and if required, there may be one or more public service announcements related to that if required, because if individuals work in a setting where all contacts can't be contacted, then a PSA is required. And this is what we do expect to see. As we are out and about more, we will see individuals who test positive, and then case contact investigation is done. And if there's public health directly contacts their close contacts, but if they work in a setting where it's not possible, then a PSA is done. And then there's an additional 46 or so cases that are part of specific outbreaks and specific communal living settings. And there, the large case numbers are actually, just like I've said in the past around La Loche, the large case numbers are actually due to active case finding, because communities are working actively with public health for door-to-door testing and case finding and testing, and that's how you see an increase in cases in people who may otherwise have had mild symptoms. But that is essential because in communal living settings, the nature of life is such that there may be communal areas for having food or for worship, and some of those practices need to pause if there's an outbreak till the outbreak settles down. So we've already seen that through early intervention, through testing, contact tracing, and specific guidance, these outbreaks do come under control very quickly, and that's what's happened in the past, and we expect that to continue as we see cases in further communities. But of course, regarding the last point about transmission, we understand that there's always connections between individuals and communities, for work-related reasons, for celebrations, weddings, funerals, and that does cause transmission, because obviously you should not attend any gathering if you're symptomatic, but sometimes people can have very mild symptoms or be asymptomatic. And therefore the caution that don't go to any event if you're symptomatic, even if you go observe physical distancing, and if you are in a setting where there's a communal outbreak, even some extra precautions about not hosting or attending any large gatherings, and this applies to any community, large or small, and I think this is something that we all need to consider going forward as more and more events and gatherings are allowed.
We'll take our next question on the line.
We have Taylor Rattray with CTV.
Taylor, are you there?
Sorry, my bad. I didn't mean to unmute.
Go ahead, Taylor.
I don't have a question right now. Sorry.
Okay, can we take our next question on the line?
We have Murray Mandrick with the Leader Post.
There we go. I'm unmuted now. The 56 cases are the largest numbers for 3 days since, I think, early May. I'm just wondering why this would not cause some serious consideration of a mandatory mask wearing order, and if not this, what would cause the province to consider mandatory mask wearing in public?
That's right. So, most of those cases are in specific settings, in communal living arrangements, where there may well be a recommendation by public health for mask use when you're not in your immediate household. But overall, southwest and central Saskatchewan is a large geographical area, larger than many smaller counties in other parts of the world, and with a relatively low population. So the 8 cases that are not linked to specific communal settings, are of concern. They are being investigated. At this point, our recommendation is that if you are indoors and can't maintain a 2-meter separation, a mask use is recommended. Beyond that, I think we will have to see a couple of things. One, obviously, we want to watch the total number of cases, not just linked to an outbreak, because through active case finding, those numbers increase, and that's valuable, but we have to look at cases that are sporadic, not linked to other individuals. Case content investigation needs to conclude. We need to understand further chains of transmission. And if we continue to see transmission happening in settings where people may have been indoor, they may have been trying to comply with 2-meter separation, but transmission is still happening, we will see occasional transmission in settings that are now open, like restaurants and bars. But if we continue to see a signal that transmission is ramping up, we will have to see what other steps need to be taken, including possibly mask use, possibly rethinking some of the physical distancing guidelines. But that's something that we actively have to track now for the foreseeable future.
You have a follow-up question, Murray?
A different one. Manitoba is down to 1 case today and hasn't had a new case in 2 weeks. They have some of the similar problems and some of the similar situations related to being relatively isolated, distance. They have Hutterite colonies. They have First Nation communities where it can spread rather easily. What are they doing right there that we could learn here? And why does it work there? Is it just because we're next door to Alberta and it's getting a little bit more imported from Alberta? Is that the case? And also, would you mind clearing up the 46 number, Dr. Shahab? I'm just wondering if that's all related to the initial call on the outbreak.
Yeah, thank you. So, obviously we work very closely across Canada and across the Prairie provinces, and certainly we can all be a bit jealous, rightfully, of Manitoba, but and I don't want to pin everything on Alberta either. I think people move back and forth. They move back and forth for work between provinces. They move back and forth for social and family reasons. Communities have close connections. And so, I think ultimately we all need to learn from best practices in every province, and that's what we have been doing, including for our reopening guidelines. I think all of us have done things slightly differently. But when we have an outbreak, active case finding and easy access to testing, which, Saskatchewan has led actually the country in deploying local gene expert testing capacities, which does very active case finding. So normally if you would find 10 cases in a community with very active case finding and house-to-house contact tracing, instead of 10, you can see 100 cases, and that's what we saw on the Lodge. That's what we're seeing in southwest and central Saskatchewan. So I think we don't need to get too fixated on case numbers, because a lot of them are produced through very active, aggressive case finding and testing. And we've got colleagues within the Saskatchewan Health Authority have played a key role in supporting that. We also need to monitor our hospitalization death rate, and that's where thankfully Saskatchewan has been low. And again, a major reason for that, actually, while each death is a great tragedy for families who've lost a loved one, but our low death rate has been due to the fact that we haven't had outbreaks in long-term care facilities. So the context in each province can be different from due to where they've had their outbreaks. But we need to monitor all our indicators and obviously compare ourselves with our neighboring provinces and within Canada and other jurisdictions and learn from each other. But at this point, I think what we have seen is, overall low case numbers for many weeks, some outbreaks in specific communities in the northwest and now in the southwest and central areas. But we are seeing now more cases sporadic in the community, not linked to any international or interprovincial travel, not linked to any gathering. And that's something we need to watch very closely. We expect to see that increase slightly as we reopen, but we need to keep a close eye on that and understand what are the settings for transmission and continue to review our guidelines and provide feedback to the public about what more can be done to keep that number as low as possible. Will not get down to the low number of cases we had when we were in fairly strict lockdown, but we need to keep our case numbers manageable.
We'll take our next question on the line.
We have Lisa Schick with CJME.
Hi. I'm just looking for a little bit more clarity on, I guess, what this jump is being attributed to. I know, Dr. Shahab, you mentioned kind of an explanation for 8 of the cases, but what about the rest? Are they all connected to that original outbreak in the Hutterite community?
So they are connected to active case finding in multiple locations, not necessarily linked to the original communities, but in additional communities where there's a case and active case finding is done. And the way it is done is that, communal living arrangements are very different from, communities are very small. They can be, 100 people, but, because of communal living arrangements, there's a need for active case finding where, community leadership works actively with public health to get ahead of the transmission. And then through active case finding, you see more cases than you would have otherwise seen, where only people who had severe symptoms and would have thought of going for testing would have been detected. So I think we expect to see a jump in cases through active case finding, and we need to track that separately from sporadic cases which is the 8 in number, which also I think lead to case contact investigation. And certainly with this expanded testing, I think we will expect to see more cases. But again, that should be viewed as a positive thing. I think we should not be concerned that as our testing numbers go up, if you see more, because the more cases you find, the more you can understand the transmission settings, the more you can provide feedback in terms of what the transmission settings are, what do we need to continue to watch for, and that's how we can try to prevent a surge that can have then pressures on the health system, which we are seeing in other parts of the world, and hopefully we can prevent in Saskatchewan through all these measures.
Do you have a follow-up question, Lisa?
Yeah, sorry. So does that mean that you haven't, I guess, determined if there's one thing that this is all being attributed to? Is it a lot of different things that this jump in cases is being attributed to?
No, the 46 specific cases are attributed to several outbreak investigations in several communities with communal living arrangements. So those are all accounted for. The 8 cases that are not linked to any specific outbreaks are all being followed up by public health. But there are 8 cases spread over a wide area, and we have to remember that we will continue to see this throughout Saskatchewan. At this point, last week and the week before, we had a focus in Prince Albert because we saw 6 cases after many weeks of no cases, and in fact, those 6 cases were hospitalized, so slightly different reason for caution in the PA area. Now there's a need for some awareness in the southwest and central area. But at the end of the day, anywhere in Saskatchewan, I think we all need to be aware of our own symptoms and seek testing if symptomatic. And I think this will have to continue for the next little while.
We'll take our next question on the line.
We have Adam Hunter with CBC.
Hi there. I'm wondering what Dr. Shahab, what you think of pictures and other images of crowding at beaches over the weekend, over the past few days, and whether you're concerned about that and what may be done, maybe this is for the minister as well, to monitor situations like this where people aren't social distancing, or maybe the beaches themselves aren't following the rules. Will there be any fines?
So, I went around quite a bit this weekend around, some very nice spots in Saskatchewan, hiking, enjoying our beaches as well. And we have to remember that, sometimes you can see a picture and, you can't really tell from a picture whether people are physically distancing or not. And I've had pictures taken of me and sent to me about people commenting on that maybe you're too close to someone. And where I knew I was 3 meters away chatting to someone when out about walking. So that's one thing. I think what I have seen, to be honest, is that people are enjoying our great summer. They're on the beach, they're hiking, they're walking around our many walks in Saskatchewan. And they are trying as much as possible to maintain that respectful and safe distance among others. But at the same time, they're interacting I've also heard that in some indoor environments like grocery stores, when things get busy, there is this sense that maybe people aren't adhering to that physical distance as much as they should, and they definitely should, especially indoors, where sometimes there can be a bit of a crowding. But I would like to reiterate that as we continue to enjoy our summers, as many sports activities start, both outdoor and indoor, the guidelines are exactly designed to keep informing people who are enjoying the outdoors or engaging in sports that you obviously can't avoid closer than 2 meters, for example, if you're playing a sport. But as you're on the bench, as you're meeting other teams or colleagues before and after an event, you have to maintain that 2 meter distance. And I think we won't prevent all transmission as we reopen, but this is a way to prevent super spreader events as much as possible. And that's what all these guidelines are for. Because if we just started doing things as we did last summer, for example, or early this year, we would get the super spreader events. And the only difference between February and now is that we're reopening. A lot of those activities are now being allowed, but the expectation is that following those guidelines, we will see occasional transmission or a cluster, but hopefully we won't see situations where 25 out of 50 people at an event got exposed. But we'll have to monitor, and we'll have to learn from how transmission continues to happen and what further advice we can give from what we continue to see as we move forward.
Adam, to your point about the beaches, as Dr. Shahab had said, we're going to monitor it, and while we wouldn't rule out enforcement, certainly that's not our preferred method. We've been as successful as we have been in this province because of cooperation of people, so certainly we're going to appeal to people to continue to cooperate with social distancing and keep themselves and everyone safe.
Thanks. Adam, do you have a follow-up question?
Yes. What's sort of a follow to what Marie asked earlier, should people be preparing for mask use and getting used to wearing masks in indoor spaces? I think Dr. Shahab, you mentioned a couple of weeks ago that there could be more of a push for that in the fall when we move indoors. Is that something that people should start getting used to the idea of?
Yeah. And before we move to that, I just want to make a comment about, the perception of people crowding together. So if you're within a household, you can be close together. And, when you're out and about, you see maybe 10, 15 people. Maybe they're part of a virtual household, so you can be close together. So I think we have to understand that people may be part of a virtual household. 15 is the recommended size right now. But if you're part of a larger gathering, it is important to, maintain the 2 meter distance. And people like me have gotten disinvited from several events because, we're pointing out things that others should be doing. But I think we all need to keep pointing those things out. It doesn't come naturally that if you have 5 households, each household should have their own dip to dip their naturals in, and not one dip that's shared between 4 or 5 households that are not part of a virtual bubble. But I think we all need to kind of police each other and, practice the best physical distancing and other rules we can to get through this, and do that in a nice way and not create any tensions. And also understand that when you have groups outside enjoying the summer, they may be part of a virtual household, and just accept that as well. Regarding the question you asked about, indoor gatherings and mask use. So I'm afraid I just remember that question before. I just want to clarify this. Could you just repeat that again?
Yes, I'm just wondering if people should get used to the idea of having to wear a mask inside. I think you said a couple of weeks ago that there may be more mask use come the fall when there's more gatherings, people back in the workplace, schools, etc.
Yeah, so we all need to have a mask on hand, and we all need to be able to put it on when we feel we can't maintain that 2 meter distance, and it should be a reusable mask that we can wash if we've used it throughout the day. And we all need to get used to wearing that and be comfortable with that. And right now the reason to use a mask may be few and far between because you're outdoors and can maintain that physical distancing. But as you move indoors, absolutely, we all need to have on hand a mask and be comfortable using it. And at this point, that's a recommendation. But if we start seeing an increase in cases as we move indoors, we'll have to see if that becomes a stronger recommendation or even mandatory. But at this point, I think, just having it as a recommendation is good, and continue to see, if it's adopted as much as it should be. And I know several other jurisdictions, some cities have enacted mandatory mask laws, some provinces have as well, but based on our context at this point, this may be the appropriate recommendation at this point, but we'll have to see what are the transmission dynamics as we move forward through the summer and into the fall.
We'll take our next question on the line.
We have Brian Zinchuk with Glacier Media.
Hi, Brian Zinchuk. I'm relatively new to this position here, Doctor and Minister, so I apologize if this question's been asked in the past. But the press release listed about 10 or so RMs. I don't recall seeing that much detail except for the Prince Albert and the Losh outbreaks. Is this something we can expect to see more of? And up until this point, why haven't we seen this sort of detail? I'm sure people would like to know if there's an outbreak in, people having it in Kenora or Yorkton or Estevan, for instance.
I think we still need to understand that, for example, we continue to see a single case who may have traveled, maybe internationally or to another province. They were a contact of a known case in another province. They are isolating at home, and we see 2 or 3 additional cases which are close household contacts. So the chain of transmission there is explained, and we don't really have to speak to that publicly because there's no unanswered question there. And so, especially in March, April, the vast majority of cases were because of people coming back to Canada from overseas, and there was no reason to speak to every case in every community. But even then, we saw a few events at a mass gathering, which we announced publicly because there's a need to reach out to people who may have had been at that mass gathering, whether it was a curling bonspiel or a supper after a ski-doo rally. And then we went into quite significant cessation of all activities except essential activities. And even there, when we saw transmission and we couldn't reach individuals otherwise, there was some public announcement of a setting where people may have been exposed. So as we reopen, again, the same principles apply. If you have a single case in a long-term care facility that's announced as an outbreak, if you have a single case in a work setting, and all the other employees can be contacted, there's no reason to announce that publicly because you know all the contacts, you can follow them up in case they develop symptoms. If you have a situation now that is becoming more common where you may have someone who works or visited a public space like a restaurant, a bar, or a grocery store while symptomatic, and then there's some concern that transmission may occur in those settings, there'll be more frequent PSAs. So I think the reason to make a public announcement is different because of the context. So 4 cases which are all linked together, like in a household setting, there's no reason to announce, but 4 cases in a small community not linked to one another is a reason to just make people aware in that community or that geographical area, whether it's an RM or some geographical area, just to highlight that we don't know where transmission is happening, but there may be some increased transmission, so just be aware of that. We should all be practicing physical distancing and everything else, but just a reminder for everyone to just be that more alert to that, and obviously, absolutely to seek testing, because that's the way you can get ahead of local chains of transmission.
Do you have a follow-up question, Brian?
So I'm still a little confused here. Are we going to see this level of detail in future announcements?
I think we'll have to see what the context is. I think we have said that we will provide more detail where we think it's feasible. At this point, there's discussion on what level of geography is appropriate. You can go large, like we have 5 large areas. You can go smaller. At this point, we thought this level of detail may be useful, but we'll have to see. At the end of the day, we need to raise awareness both provincially and locally. And things change. Like after a week or 2, if things settle down, certain parts of the province may not be of a higher level of concern. But certainly that baseline concern should be there for everyone. Just because you live in a part of the province that's not in the news release doesn't mean absolutely that if you have a cough or fever, you can dismiss that as not due to COVID. I think we have to look at it from both perspectives. that it may help in people just being more aware if they live in a specific part of the province. But I think we should not be complacent if we live in any other part of the province either.
Perfect. Thanks, everyone. That concludes today's press conference. As always, if media have further questions, you feel free to send them to SHA, Ministry of Health, or your Executive Council Media Relations Officer. Thank you, everyone.